Hello, everyone. My name is Faith, and I'm going to be presenting today about mental health stigma as a health concern. Stigma in healthcare is a prevalent concern and can affect both the patients and care providers. According to research, mental health stigma is common in medical facilities and even among medical professionals. That's according to World Health Organization's report of 2022. Stigma has profound effects such as discouraging those affected by mental health disorders from seeking help, aggravating their conditions, and even compromising the effectiveness of interventions when delayed. It can also cause non-adherence to treatment plans, and in some cases, patient might end up missing follow-up sessions because of stigmatization. It's important to address mental health stigma to improve access to care, lower inequality in mental health outcomes, and improve the utilization and effectiveness of care. Stigma remains the most significant barrier to mental health utilization, which leads to poor outcomes in community mental health. Several factors contribute to mental health stigma. The first factor is limited education on mental disorders and general mental health care, which results in misconceptions and stereotypes. The other issue is cultural and social beliefs, which may influence individuals' perceptions of mental health, resulting in divergent views and misunderstanding that breed stigma. The existence of stereotypes on mental health is another enabler of stigma because they propagate negative perceptions on being mentally ill. To counter stigma, some strategies developed include education and campaigns against stigma. Collins et al. Research of 2019 by the name California's Mental Illness Stigma Reduction Campaign, they did conclude that reducing stigma resulted in care utilization. The spreading of accurate information on mental health and healthcare helps to counter misinformation that's out there. Institutions may face difficulty fighting stigma, including limited resources and inadequate policies. Providers in the healthcare settings could be prejudiced and propagate stigma, and as key players, this can significantly reduce effectiveness of intervention strategies. Furthermore, systemic inequalities breed stigma since some underserved communities develop negative attitudes towards mental health care. These inequalities create additional barriers to the underserved and intertwines with other social inhibitors like socioeconomic constraints and prejudice related to gender, race, and sexuality. Care providers are central in fighting mental health stigma. They should encourage discussions on stigma to help reduce stigma and create awareness. Furthermore, care providers should build a supportive environment that fosters care utilization. As an advocate for healthcare, they should also participate in policy improvement and other awareness strategies. These efforts should include countering systemic discrimination and institutional barriers. Hashtag Do Your Share campaign is an anti-stigma campaign launched by the Pan American Health Organization in partnership with the World Health Organization. This program encourages everyone to join in and challenge the mental health stereotypes. Mental health first aid is an extension of the traditional first aid training, teaching people how to understand, identify, and respond to mental health issues. In the future, mental health education should be integrated into various education curricula to counter mental health stigma and reduce spread of stereotypes and misconceptions. Furthermore, strategies should be implemented that target a cultural shift towards acceptance of mental health as routine healthcare by utilizing ad campaigns, training programs, and policies. These are the 4 references that I used in researching my presentation. Thank you.